CATCH stands for Community Access to Child Health.
And its mission is to support pediatricians to collaborate within their communities to advance the health of all children.
To me, CATCH is a program designed to engage pediatricians, put our patients at the center, and think about the needs that maybe we could meet for them that we're not currently meeting.
CATCH is an incubator of ideas, and that's something that's very necessary and rare in medicine.
CATCH grants really help pediatricians think, how can I work outside of my office and really make an impact on the kids and families' lives?
It really is a call to action for pediatricians to do advocacy, to really look at the clinical care that they are providing and say, is it good enough?
It gives them an opportunity to own an area and actually have a way, a formal way to try to address an unmet need.
As a pediatrician, you get involved in your community and you have a mission, you have a goal to actually help make your community better. CATCH allows you to get funding to accomplish that goal to help your community.
I saw the impact that CATCH had in my own community, in my own clinic. You know, I was fortunate enough to work with the CATCH program for many years, and during that time, I saw that repeated time and time again in other communities, the same kind of beneficial impact.
CATCH, which was supposed to be a very easy way for pediatricians to step outside their offices and get funding to the tune of $10,000 for whatever number of years. Dr. Francis Rushton took over the program nationally and called it CATCH, Community Access to Child Health. And so he was important in sort of merging it with the American Academy of Pediatrics, but he came to announce the Wyeth funding for planning grants. And I was lucky to be at that meeting, and as he described the grants, it struck me that perhaps I could get one. And I guess I was thinking, goody, let's take advantage of it. I scribbled it on a napkin, and as he was leaving, I thanked him for the Wyeth announcement and said, stick this in your pocket and see if you might be interested in this one. And I put my phone number there, and I think it was not too long after that that he gave me a call.
Bron got the CATCH program going, probably got us off to a good, healthy start. I mean, she was a very inspiring person to work with because she always showed a lot of enthusiasm for whatever she was involved in.
Bron has done something which is almost CATCH 2.0. She's not only provided care, but she's also really supported the communities themselves. Many people now are following her example, but she's way out there with the idea that it takes a strong community to really provide the healthy access for children and the healthy environment for children.
In medical school, she told me that she made a career in part on many small community projects. And I realize now that those were CATCH projects.
In San Diego, one of the reasons why CATCH has had the longevity that it has and the impact that it has is when you have a leader like Bron Anders, who was really the first person to get a CATCH grant here in San Diego, and she stayed involved with the chapter. She's been able to not only get CATCH grants for herself, but she's encouraged others and inspired others.
It really fosters that part of you and that fire within you, whatever that light, that is why people wanted to be pediatricians in the first place in many ways.
The wonderful part about being at the 25th anniversary of CATCH is it allows you to think of what is CATCH going to look like 10 years from now, 20 years from now, 50 years from now.
As medicine grows, I think CATCH will be the glue for the physician out treating patients, community physicians, to bring new ideas to the community of the physicians that are out there who are working not hospital-based but community-based.
One of the reasons CATCH has been around for 25 years is its focus on sustainability. When people write CATCH grants, that's a big thing we look at, is how sustainable could this program be?
Rather than me predicting what it's going to do, I know, I'm confident that based on the people currently working with CATCH and based on the vision of the Academy, that it'll be doing things that we didn't even conceive of today.
The program has done a good job of looking at a community and seeing not just the kids that come into a pediatrician's office, but basically looking out for other kids and to see who isn't coming into the office and what's preventing them from doing so. And one of the key concepts of community pediatrics is advocacy for all children, not just those who have certain insurances or lack of insurances, but basically create the same standards for everybody.
I'm trying to think back to that time that I had the opportunity to meet Bron Anders the first time. And I think the best way to put it is she walks into the room and you just know there's something about this person where you can feel her caring, you can feel her commitment. And when she talks, you understand that here's someone who talks, but the way that she really talks is in her actions and the way that she brings people together.
I was always so impressed at the way she would go right up to the parent or the child, bend down right at their level, touch them on the shoulder or take them by the hand. It was just the way that she was so compassionate that really left a mark on me.
It's amazing to have someone like Bron who not only has a good heart towards kids and families, she has a great heart towards other pediatricians, and she's helped uplift everybody that she comes in contact with. And she's one of those people who never asks for help herself, but she is so ready to give help.
I was scheduled to have a lecture from Bron, who I hadn't met yet. And she came in kind of harried and disheveled, and it was only later that I realized that's because the day before her home had burned down. She nearly lost her life, but she was so committed that she showed up in borrowed clothes to give this lecture to the pediatric residents about the importance of community pediatrics.
She always had a laser-like focus on doing what was best for kids, and obstacles didn't seem to get in her way, whether it was geographic barriers or financial barriers to developing programs or logistics. She never seemed to be too worried about that like others would. She plowed straight ahead. She really was approachable and really wanted to get to know you as a person. Bron, thank you for inspiring us.
And improving the lives of families.
Bron, thank you for inspiring us.
Thank you for inspiring us.
Thank you, Bron, for inspiring us.
Thank you for inspiring us and improving the lives.
Thank you for inspiring us and improving the lives of children and families in our community.